I'm suffering from joint pain, it's very uncomfortable. Many people are suffering from joint pain and osteoarthritis like me. Especially patients who are of working age, their ability to work will be greatly reduced. Inflammation is part of the body's normal response to injury. However, in rheumatoid arthritis, RA, the inflammation becomes chronic or long-lasting, causing pain for the patient. Arthritis is a common disease, causing many difficulties in living and working, affecting the quality of life of patients. Arthritis symptoms can include joint swelling, pain, stiffness and decreased range of motion. The two most common types of arthritis are osteoarthritis and rheumatoid arthritis. Regardless of the form of arthritis, controlling and reducing inflammation is essential to reducing pain, stiffness, and swelling. Osteoarthritis is one of the most common forms of arthritis today. The disease is common in the hip, spine and knee joints, when the cartilage covering the joints is worn and damaged, leading to stiffness, pain and reduced normal mobility. Here are 10 best foods for people with arthritis and osteoarthritis. Number 1. Foods rich in omega-3. Osteoarthritis experts advise patients to eat fish because this food is really good for arthritis patients. The reason is that certain types of fish are good sources of omega-3 fatty acids that help fight inflammation. One study found that people with the highest omega-3 consumption had lower levels of two pro-inflammatory proteins, C-reactive protein, CRP, and interleukin-6. Fatty fish such as salmon, tuna, sardines, mackerel are rich in omega-3 fatty acids, which are effective in reducing inflammation in people with arthritis. According to the Arthritis Foundation of America, eat a serving of about 100 to 130 grams of these fish twice or more a week to protect the heart and reduce inflammation. Fish oil supplements also help reduce swelling, joint pain, and morning stiffness in people with rheumatoid arthritis. Scientists opened up a small study with 33 participants to follow a diet of fatty fish, lean fish, and meat 4 times a week. After 2 months of study, the group consuming fatty fish tended to have the highest reduction in inflammation. Number 2. Extra virgin olive oil. According to doctors, olive oil contains a lot of polyphenols. This type of substance not only supports against cancer cells but also works very well in repelling inflammation in many parts of the body. The most typical is arthritis problems. Therefore, you can incorporate olive oil into your daily diet. However, you also need to know how to use olive oil effectively because it is often difficult for most people to drink this food directly. To easily drink olive oil without feeling bored, you can mix 1 tablespoon of the oil in a cup of warm water and drink it slowly or mix it with a salad. In particular, when drinking in the morning, the body will absorb more nutrients in olive oil. When using extra virgin olive oil, be careful not to heat it to high temperatures, about 410 degrees, as this loses some of its beneficial properties. Number 3. Berries. Many fruits are rich in compounds called flavonoids and polyphenols. Polyphenolic flavonoids are associated with antioxidant, anti-inflammatory, and pain-relieving properties. In particular, blueberries, raspberries, strawberries and pomegranates have shown positive results in reducing pain and inflammation in arthritis clinical studies. Peaches, grapefruit, oranges, strawberries are fruits that contain high levels of vitamin C. Meanwhile, the addition of this vitamin helps the body control and prevent the bad changes of arthritis. In addition, patients with arthritis are often accompanied by cartilage loss, and vitamin C is completely capable of stopping the development of this condition. Number 4. Green vegetables. Leafy greens are a great addition to any diet, where dark leafy greens, broccoli, beets, sweet potatoes and cabbage are especially good for people with arthritis. They contain many healthy nutrients, such as antioxidants, polyphenols, fiber, vitamins and minerals. Eating vegetables rich in vitamin K such as broccoli, spinach, lettuce, Kale and cabbage significantly reduces inflammatory markers in the blood. And the group provides many calcium absorption vitamins such as bean sprouts, mushrooms, vegetables including spinach. Tomato is a fruit rich in vitamin K, good for bones and joints. It is best to eat a variety of combinations of vegetables and fruits in your daily diet. Number 5. Green tea. There are quite a few patients who are encouraged to drink green tea when wondering what people with arthritis eat. However, most people do not fully understand the benefits that green tea brings to the body. In fact, green tea contains a lot of catechins, a substance with antioxidant effects. As a result, when using this food, patients can fight or limit the possibility of inflammation and prevent damage to cartilage. Animal studies also show that green tea can help reduce the incidence and severity of rheumatoid arthritis. The best time to drink green tea is 1 hour before and after a meal. If you are on a diet and want to control your appetite, you should drink green tea an hour before a meal. Drinking tea helps support digestion and absorption of nutrients and vitamins and promotes the most effective treatment for rheumatism. However, do not drink too thick tea and should not add sugar to the tea because it can lose flavor, reduce nutrition and have healing effects. Number 6. Whole grains. Whole grains provide fiber, vitamins, minerals and antioxidants. In addition, whole grains also contain many complex carbohydrates, which provide a great source of energy for patients. Whole grains are high in fiber, which can help you maintain a healthy weight. Some studies have also shown that fiber and high-fiber foods can reduce levels of CRP, a marker of inflammation in the blood. There are many varieties to choose from and incorporate into your arthritis diet. These add nutrients and fiber that only whole grains can naturally provide. For best results, the Arthritis Foundation recommends eating 50 to 180 grams of whole grains per day. Patients should choose foods made from whole grains such as whole wheat flour, oatmeal, brown rice. Number 7. Milk and dairy products. This is one of the best dietary sources of calcium. Milk contains 18 of 22 essential nutrients, including calcium, phosphorus and vitamin D, enhanced by the enzyme that converts milk sugar into D-glucose and D-galactose, good for bones and joints. Additionally, thanks to added nutrients, milk and some yogurts are also safe sources of vitamins A and D, may benefit bone health. Vitamin D and calcium help build and maintain bone health, which is important for both arthritis and rheumatoid arthritis. Probiotics are healthy bacteria commonly found in dairy products like yogurt. Several studies have shown a relationship between probiotics and improvements in inflammatory activity in rheumatoid arthritis. Number 8. Ginger and turmeric. Ginger, garlic and turmeric are popular spices for their healing properties. However, very few people know their true properties are to cure knee and back pain. The active ingredient curcumin in turmeric has powerful anti-inflammatory properties. They have been used in recent years as a valuable medicinal herb and as a spice in cooking. Studies have shown that turmeric is the best active ingredient for pain relief from chronic arthritis and joint pain. It also relieves symptoms of ulcerative colitis and osteoarthritis in the elderly. Like turmeric, ginger has long been known to reduce inflammation effectively. Studies show that using ginger can help reduce pain and inflammation more effectively than non-steroidal drugs. Number 9. Nuts. Nuts are high in monounsaturated fats that have anti-inflammatory effects. Although they are relatively high in fat and calories, studies show that eating nuts helps with weight loss because their protein, fiber, and monounsaturated fats cause feelings of fullness. Arthritis patients should eat about a handful of nuts a day from nuts such as chestnuts, walnuts, pine nuts, almonds. Number 10. Mushroom. Mushrooms contain a large amount of nutritional components that help strengthen the body's resistance and prevent the process of osteoarthritis. Not only good for bones and joints, mushrooms also help improve diseases related to heart disease, diabetes, obesity and cancer. Osteoarthritis was also significantly improved. The dishes made from mushrooms combined with some vegetables such as carrots, peppers, broccoli, will help supplement vitamins A, E, C, K to help muscles and joints more supple.